Hello, ladies and gentlemen. So I have to be completely honest. When it was first suggested to me that I might like to do a vlog, as I understand this is called, I responded that I'd really very much rather crawl under a stone. However, as there are no stones around, that really isn't an option. So here goes nothing. This week is 1 year to the week that I have been in post as medical director at Northampton General Hospital, and so I've been doing a fair bit of reflecting. You'll be delighted to know that I'm not going to try and cram all of my reflections into this inaugural vlog, but rather I think we will be chunking things up into bite-sized pieces that you may not necessarily fall asleep during, and I am going to start with what I think is probably the most important topic of my reflections, and that has been the senior medical workforce here at Northampton General Hospital, or ladies and gentlemen, that's you and me. So I suppose where to start? Well, I suppose there are three main areas that I would like to cover, and one would be I suppose the workload of the workforce. One of the things that I was particularly struck by when I arrived at the hospital was the huge amount of hard work delivering excellent clinical care for our patients, really across the board, and a huge amount really to the point of being too much hard work. The workforce gaps, the vacancies amongst our consultants and indeed our junior doctors, which has a compounding effect in terms of the workload for we consultants, of course, was substantial, and because previous recruitment drives hadn't been as successful as we would have liked, it seems that the response has been to overload people's job plans and expect the existing already thinly stretched workforce to continue to deliver all the services that are required in the face of growing demand, particularly in emergency medicine, but really across the board in a hospital serving a growing population. I have had, and still to a certain extent have, some concerns around the impact on the health and well-being, sustaining that in the long term. It isn't the right way to treat you if we are to look after our workforce and make sure that they stay and continue to look after our patients. So rather than that, what did I do about it? So revamped and reinvigorated our medical recruitment strategy at some pace and took really quite decisive action. And as by now I hope all of you are aware, we have got 20 additional consultants who will be in post by December 2018, compared with 12 months before. That's a net increase because it takes into account leavers, and percentage-wise in an organisation of this size, that's 8.5%. So a bigger uplift, and I hope that by now some of you in those particularly badly affected specialties with consultant gaps are beginning to feel the impact of the new workforce coming on stream. There is clearly still a lot more to do, and alongside continuing with the recruitment efforts, we will also be moving into the new phase of the work to retain and support our existing workforce. So that includes changing the trust retire and return policy to make it more flexible to the needs of the service, but also to the needs of we consultants, which is expected to come into effect from April 2019. And it also includes what we do to support and develop our existing workforce. So we have developed a new consultant starter pack that we will be sharing with you shortly for your input and feedback to make it better. And I'm also reworking the Consultant Foundation programme, and this is a plea for volunteers. Anybody who has an interest, both in terms of what we should be covering in an advisory role or indeed in delivering some of the development, please get in touch. Would really make the programme of support much better, because the support and development of our consultants leads very much into my second main point around consultants, which is our collective sense of ownership of our services and engagement, both in responding to challenges and waiting lists and targets, etc., etc., delivering safe care, but also around more positively and upliftingly developing the services in the direction that we would like to take them. And to that end, really, when I arrived in the organisation, many of you told me, and I perceived quite strongly, that you felt frustrated and disempowered, that your expertise was not appropriately recognised and used to support developments and services. And I perceive that myself, and clearly that is inappropriate. You know, we are the clinical experts, and service developments that do not take our voice into account will be the poorer for it. And as you know, what I have done about that is to work through the medical director forums and the consultant working suppers, online polling, the consultant voice, and also setting up the consultant forum chat room, making sure that your voice is heard corporately, and develop the consultant engagement strategy, which we're now into the delivery phase of. And I'd like to say thank you all very much for your input into that. And it's a living document, it's a living policy, so please continue to provide feedback and we will continue to improve it. Thank you very much. I suppose the final thing I just wanted to touch upon in relation to trust values, for me, respecting and supporting each other is absolutely essential as consultants. I would have to say that for all that we've just been talking about, how disempowered consultants have felt here at Northampton General Hospital in some cases, the way in which we are perceived by the other 4,000 plus of the workforce very much is as the senior leaders, as very powerful people in the trust. And I think we need to be mindful of that in the way that we communicate courteously and sensitively with them. I've been really grateful for the way that you've responded to prompts and nudges in that regard. So, for example, the email communications from consultants, between consultants and two others, have improved dramatically in accordance with trust values and policies. So, thank you ever so much for that. So, I think I'm going to stop there in relation to my reflections on we consultants here at Northampton General Hospital, and move on shamelessly to 3 quick plugs. The first is a big shout out for 2 new executive colleagues. So Sherrin Oak is the new Director of Nursing who started last month, and will be building on the excellent strategic and professional work that Carolyn Fox has done with the nurses in her years here at Northampton General Hospital. And this month a new Director of Governance will be starting, again building on the structure that Catherine Fawn has built here. And I'm sure that you all join me in making them very welcome here at Northampton General Hospital. My second plug is for 2 corporate medical posts that I would like expressions of interest in and applications for, please. You will be aware already that I am replacing the Director of Medical Education, and I'll be going out for advert for this today, and please, people with the requisite interest and experience, apply and get in touch. Look forward very much to hearing from you. The second post you will not yet be aware of is an Assistant Medical Director for Patient Safety, who will be prioritising the recognition, timely recognition and response to the deteriorating patient in a holistic manner, and that will be advertised shortly. And again, please get in touch with me if you have interest in taking up such a role. And then finally, the consultant forum is there for you to use to build links with colleagues and communicate between departments. And please also use it to raise things to my attention, and please continue to set the agenda for Northampton General Hospital. Thank you very much.